First topic that we are going to start now in communicable diseases is measles. Measles is also referred as rubella. Now, measles is a very highly infectious disease and it is usually seen in children and it is caused by a virus that is called as paramyxovirus. So, usually when the child develops with measles, they will be having fever, then it is also associated with some upper respiratory tract infections like cough, they can have lot of sore throat, fever is also associated with it, and there is development of a typical rash that is referred as a complex spot. We will see that in the clinical features. And this measles is very common in developing countries and sometimes it can result in even mortality. Now, there are some challenges for the measles elimination. That is because of weak immune system, that has been one major problem. Other than that, measles can be highly infectious. That has also become one of the main cause for control of measles. Then it is very high in the developing countries, especially in the population. And there are some individuals who refuse for immunization or vaccines. So that is why treatment of measles has become slightly difficult. Then one more factor that is responsible is the change in the epidemiology of measles. And along with that, there is gap in the human and financial resources. So whatever resources are available, it is not properly distributed in these developing countries. So because of that, treatment of measles has become a bit difficult. Next is moving on to etiology of measles. So as we are already aware, measles is caused by RNA paramyxovirus, and most of the time it is transmitted because of droplet infection, that is secretions from the nose or throat or even the respiratory tract, and it is usually transmitted during the time of sneezing or coughing because the droplets will be seen in the will be found in the air and that in turn may be inhaled by the other person, and that is why it is told to be highly infectious in nature. Then risk factors. Now, most of the time, children who are less than 1 year are at high risk. Even it is commonly seen in children between 6 months to 3 years of age because of the environmental factors. That is commonly it is seen in poor countries. Children who have low immunity, who are malnourished, or who do not receive the vaccines, they are again at high risk of developing measles. Next is incubation period. Incubation period is commonly seen in between 10 days to exposure of the onset of the symptoms, that is till the appearance of the rash, that is their incubation period. So it may range for around 2 weeks. Next is the clinical manifestations. Now, the clinical manifestations of measles is divided into three stages, that is prodromal stage or pre-eruptive stage. Next one is eruptive stage, and third one is post-measles stage. So, first one moving on to prodromal stage. So, this prodromal stage it begins within before the 10 days of infection and can last up till the 14th day. And initially, in this early stages of prodromal stage, the child may have or the person may be having fever, lot of excessive coughing, sneezing, they can have nasal discharge, sore throat, excessive lacrimation, that is discharges may be seen, redness of the eye and excess of coughing will be present. Along with that, the child can also have anorexia, nausea, vomiting or diarrhea. Photophobia is also very common, that is sensitivity to light. Then after this, what happens is after 1 or 2 days after this prodromal stage, usually there is development of a rash which is called as complex spot. And this particular complex spot are very small or very tiny and they usually appear in the buccal mucosa. And they can be commonly first seen in the oral mucosa. Later, it can be seen in the other parts of the body. So, second one is the eruptive stage. So, eruptive stage is a stage where there is development of a rash, which is usually macular or a maculopapular rash. First, it appears in the face, that is, it could be seen behind the ears or in the neck region and all. After that, it will spread to the lower extremity and even to the trunk. So grayish spots, maybe it is the size of the grain or like sand, and initially it is seen only in the mouth, inside the mucous membrane of the mouth. That time it is referred as a complex spot. Then usually this rash is not itchy, usually does not result in itching, but after during the stage where it is healing, during that time the child can have peeling of the skin in the region wherever there was rash. Next is post measles stage. So in this stage, third stage, there is weight loss. They can have excess of fatigue or weakness. Then they can be susceptible to any bacterial or viral infection because of the low immunity, or the child can develop with the growth retardation. They can develop any other bacterial or viral infections like candidiasis. Then complications of this measles, most of the time it can result in pulmonary complications like pneumonia, or a person can also have paralysis or muscle rigidity and all. And usually the child will be having low immunity, due to which they can get other infections like pneumonia, encephalitis, then otitis media. These are the common complications that is seen in a child with measles. So that is why it is very important to manage the measles at a very right time. So diagnostic procedures, usually you can collect history and just go for physical examination. That is, you can detect this complex spot in the oral mucosa, in the face region, in the trunk, or in the lower extremity. And certain blood investigations can also be performed. Next is management. Now, particularly, we don't have management for measles. Only thing is we can treat the symptoms here. So we have to give plenty of rest, then encourage the person to take lot of oral fluids. Then along with that, you can also advise them to take analgesics like acetaminophen or ibuprofen if they are having body pain and all. Then excess of fever is present, you can give them tepid sponging or sponge bath can be given. Then if they have got sore throat or cough, humidifiers or vaporizers can be used. Salt water gargles can be advised. Steam inhalations also can be given. Then if they have got secondary infection, in that case we can give antibiotics. Then vitamin A supplements also can be given to the child. Then most of the time prevention can be done by giving the vaccine, that is the MMR vaccine, which is commonly given. First dose is given at 12 to 15 months, and second dose is given at 4 to 6 years. So that is particularly about this prevention of this measles.